Now in the fourth section we will talk about the management of deaf child. In the management we will talk about some preventive guidance for the prevention of deafness. What are the different hearing aids that can be used, and also about cochlear implants. The management mainly depends on the degree and type of hearing loss. If it's mild, moderate, or severe, or it's complete deafness or complete hearing loss, and also about whether it's conductive type of deafness, which is due to abnormality in passage of sound waves from the external auditory canal or external ear to the middle ear and then inner ear, or sensory neural hearing loss in which the main problem is in the inner ear or in the auditory nerve, in which the transmission of sound is not to the brain, where interpretation of sound occurs. So type of hearing is very important depending on what type of management is required or done. If it is associated with blindness or mental retardation, this can affect the management also. If it's prelingual or postlingual, and again very important factor in the management. If the deafness occur late, or if it's delayed and language is developed and speech is developed, then the management will be different. And if it's prelingual, if the child or the newborn is born with deafness or hearing loss, and then they don't have language or speech developed, in that case management is different, and the management will mostly depend on the approach, how to develop communication in the children so they can have the means of communicating with other people. So again, all these factors play an important role in the management of deafness in the children or even in the adults, because if in adults, if it's postlingual, management will be different. If it's prelingual, management will be different. Parental guidance. Parental guidance is very important as far as the management of deafness is concerned, because as soon as the patient become aware or they become suspicious that their child is hard of hearing or the child is deaf, then the first step begins with the parent, because then they need to start with the communication with the children in a manner that makes them comfortable and makes them understandable, and then they should go for help as soon as possible, so that can help in the development of speech and language in the children. Language develop as they keep on listening to different sounds from their parents. So it's very important that mother, even though the child is hard of hearing, mother should keep on communicating with their child, keep on talking loud so they can understand at least the expressions, or they can start lip reading of the mother. And then next step is again to look for some special schools, special places where they can have their children, or they can have all the facilities available for the disability they have. There are special places where they can have education for special children, where they learn the sign languages, they can learn the tactile procedures and all those different methods. So Parental guidance is very important, and that should be the first step once they know that their child is hard of hearing or deaf. Then different hearing aids are used for to get improvement in hearing, depending on what type of deafness is. Sometimes if cochlear implants are not required, if they can hear somewhat and it's not complete or permanent hearing loss. So cochlear implants are used when there is no hearing at all. This is the diagram that shows the hearing aid, and this hearing aid, they produce or amplify the sound. If they can hear little bit, this can cause amplification of sound waves that reach the ear, so the child can hear better. This is the diagram of cochlear implant. This is the cochlear implant, and these are the sound processor. This is the internal implant, and these produce cause amplification of the sound or generation of the sound that is transmitted to the auditory cortex for interpretation. Next, development of speech and language. Improve hearing through amplification of the residual hearing or cochlear implants. So the main function of this hearing aid is to improve the hearing, and they improve the hearing through amplification of residual hearing. Develop visual or tactile means of communication. So different people can communicate by tactile or by feeling, or they can learn different visual methods like developing sign languages or developing like a method of lip reading, so they can communicate with the people around them. Two types of skills are there as far as deafness or hard of hearing individuals are concerned. We have receptive skills and expressive skills. In the receptive skills, there is written language. They can receptive skills, written language, lip reading, sign language, all these are visual skills. Then we have sound signals like hearing aids, cochlear implants, and then vibrotactile aids. All these are receptive skills. They can receive information by sign language, they can receive information by lip reading, and they can, by written language, they can read, and then they can. But usually, again, one of the method by which they can learn about written language, keep reading to these children every time when your mother or the teacher sit with them. The reading is very important. Then another is expressive, how they can express themselves by hearing impaired, usually by oral speech. Sign language or finger spelling is another, and then written communication. So these are all the methods that are helpful in development of speech and language. They have the sign language, they have the finger spelling method of explaining, they can do lip readings. All these methods help to develop speech and language in the deaf child. Auditory oral communication, again, auditory oral, reading books to the deaf children, and at the same time book is in front so they can use their eyes to follow, and then auditory oral communication. That's all about different methods of how we can assess or manage the children with the deafness. Thank you for watching sqadia.com.